I think we may have shared the agenda, but what I'm going to do kind of quickly today is give a quick update on what we've been doing, kind of activities since the last one of these calls, which was in June. And then if anyone else has anything that they'd like to share, they think would be kind of relevant, this, be great to kind of hear work in this space that you're doing. Then I want to kind of have a quick, we've just closed the NDR for this year, and I want to kind of have a quick first look at some of the key findings around circumstance data and some referral data that might form the kind of basis for kind of interesting kind of policy kind of themes for the next year. So we can have a look and then a bit of a discussion about those, if anything, if you agree, if it reflects what you're seeing or not. And then I want to do the second half hour, or kind of the second half really, on family hubs. And I know that for those of you who are joining from Scotland or Wales or Northern Ireland, it's not, it's not a policy area that's kind of relevant for you. You are obviously more that can stay the better, and if you want to kind of feed in and kind of hear what's happening, we're perfectly welcome. But I wouldn't be offended if you left. But I also would be really interested if there was anything from Scotland or Wales and Northern Ireland that you do want me to add to this agenda in future that we can kind of build in as a discussion then. So do let me know kind of either that afterwards or drop me an email. But I do know that you've got a manager, any home sites in Scotland have a managers meeting tomorrow, and I think I'm on the agenda for the November managers meeting in Scotland, and we're going to be looking ahead to the Scottish election for next year. So that is a theme that we'll be looking at kind of later on as we go through the year. Okay, so what have we been doing this since June? We hosted a meeting with Andrea, led some visits to a family hub in Manchester. I know I've just seen that Shelley's on the call. Shelley did an amazing job and showed Andrea the work that we're doing that was happening there. I think Andrea's also been to a family hub near Warrington in Cheshire. Ellie, I think you were on the call. Were you involved in that at all?
Yeah, well, she came. Unfortunately, I was on holiday. We only deliver Dad Matters currently in Halton, but she did come to Halton. She met our Dad Matters coordinator. Yes.
Great. We know that she is a big fan of Dad Matters and obviously family hubs in general. So that's great. You might have seen that she has a webinar on tomorrow night to launch her new foundation, and I think that Kieran is speaking at that, so that's exciting. I met with two MPs. I met the MP for Kettering and the MP for Hyndburn in Lancashire. They were both mission champions at the time. I'm not 100% sure that mission champions still exist now that they've kind of rejigged what they're doing in Downing Street, but I went to them to talk to them about Home Start. The MP for Kettering really knew about her Home Start and was a big fan, and she's does a lot of work with the MP for Hyndburn didn't, and we're hopefully trying to arrange a visit for her to go visit her Home Start and see the work that they're doing. I had a conversation with the policy team at Number 10 as they were developing the Better Start for Life strategy, and then obviously we did a response to that Better Start in Life strategy. When that came out in July, I've met with the Childcare Choices team, although I think that has now been dissolved and they've relaunched Childcare Choices, but at the time they wanted some help to promote to families the need to register by the end of August for free childcare hours. I don't think that campaign particularly went very well, because of the fact that they were getting in touch with us in July saying, please, can you tell families that they need to sign up to this and give them information, means that they probably had a big gap in that. I did tell them that, it's not great from my point of view, seeing as this is my job. I said, I work in this sector and I have a child who's kind of 4, just coming out of nursery. I've never seen the Childcare Choices website before, so if I'm not seeing it, I reckon the chances of anyone normal seeing it is pretty slim. Anyway, that's now been replaced, and they're trying to bring together all the Better Start in Life things into one hub, I think. We supported the Royal Foundation's early childhood animation series. Catherine Barber from Oxford was involved with Alex Courgère in kind of helping develop that series. That launched last month, I think it was, and we helped kind of promote that. And we're going to be building those from a practice point of view into the prep course and volunteer training. And there's some really great resources there for volunteers. And then I've been working with the National Centre for Family Hubs around after their launch, and I've been arranging calls with regional reps, but I can talk about that a little bit more later. And coming up, we've got the Labour Party conference in September. I'll be attending that again this year. We attended the first time last year. I'll be attending that again this year, and I'll be going with Jodie Reid, who is one of our incoming chief execs. We had a conversation. She starts next week. Her and Natalie start next week, and one of her first things will be attending this. And so we had a chat yesterday about what we're going to do there, who we might want to target. If there's anyone that I'm sure if you've got a Labour MP, they'll be going. It's quite hard to meet MPs there, but if you would like me to drop them an email and see if I could read, they probably won't meet, but just the dropping of the email is a good connection point. If you want to do that, just let me know. Or if there's anyone else that you think might be there, a funder that you want Jodie to meet again, let me know, and we can try and set those up. Then we'll also be doing Scottish general election planning, so Scottish election next year. How do we but I'll be working with Eliza on that, who's as well as being CEO for Edinburgh, is also doing a day a week as a kind of Scotland coordinator role. And she's a meeting tomorrow as their managers meeting. But then obviously we've got policy and election stuff on in November's agenda. And then it should be the child poverty strategy. And so when I first started this, I kind of added that in, and now I've put 3 question marks at the end because that keeps getting pushed back. And it was meant to be, when I looked on their website, it still said May 25 was going to be publication date, and now we are obviously September. It was meant to be the end of the second year, towards the end of the year. In the Better Start in Life strategy, it said the end of the year, by the end of the year, which definitely makes you think the end of December. But now with Liz Kendall moving out of the Department for Work and Pensions, and also Ali McGovern, who was in the Department for Work and Pensions working on this and had poverty in her job title, she's now moved out of DWP as well. I'm not sure who is going to lead. Bridget Phillipson is still there and is chairing it, but I've not seen any updates. I have asked around from people who are going to work more closely with officials on child poverty to see if they know anything, and I've not heard anything back yet, but we'll see. So that's what we've been up to since June, and the kind of some highlights for the next kind of quarter. Is there anything else anyone else wants to add? I don't know whether we've got anyone from Glasgow North on the call, but you had, if people didn't spot, had a really excellent event the other week. I didn't know if we had anyone on from Glasgow North.
I can't anyone hear Matt from Glasgow North today.
Right. I can't see everyone now. So
yeah,
so if you've not seen on it, they launched their new family hub or hub in Maryhill in Glasgow, where their old offices were. If anyone ever went to their old office, the office bit's moved, but in that building they've launched a new hub working with kind of health midwifery service and other kind of agencies. And they had a launch last week. It was attended by the First Minister for Scotland and John Swinney, and I think it was a really successful event. Sarah McMullen and Vicky One went from Home Start UK and said it was a fantastic event, and they all said wonderful things about Home Start and that piece of work. And I think the First Minister said that it should be a model for families across Scotland, which is great and what you want to hear. And so the obvious question is, okay, well, how are you going to fund that, make that happen? But they're kind of follow-up discussions with them. Is there anything anyone else wanted to say? I don't know, Eliza, whether you've got anything any conversations you've had in Scotland. I've put you on the spot there for sure, but
No, it's okay. Yeah, there's probably like lots of stuff going on about manifestos in Scotland for the elections, which we don't have one, but there is at the moment in draft, and it's just being prepared, things like talking points generally about how to like support parties or ministers to get behind agendas that are sort of appropriate for babies and young children, language that people could be using if they're like, putting out calls to ministers or having ministerial visits. So there will be some like helpful kind of documentation and stuff that can come out in the next like period. And there is sort of lots of events that will be happening from October onwards. Which you can sort of provide a bit more information, and there will be some information at the managers forum tomorrow in Scotland to share with the network. So
great, awesome. So anything anyone else wanted to add before I move on to the next bit? Only thing I would say is if I keep a list of oh yes, briefly, and I will come to you in a second. I keep a list of MPs that we have kind of contact with. I mean, I think I should probably do the same for MSPs and assembly members in Wales and Northern Ireland. So I can add those tabs to my sheet. But if you have any kind of, if you host a visit with your MP, if they kind of come and see your work or anything like that, do let me know, because then I'll update that list, and so I can see kind of which MPs are kind of connected into the network and kind of know about us, and know where it's not a kind of, if we ever need to get in touch with them or speak to them, it's not a completely kind of cold introduction. I know that lots of home starts have good relationships with their MPs, so it's good to know about that. So do just drop me an email if anything ever kind of happens. Prue.
Morning, Matt. I was just going to make the point in terms of what was said about manifestos, etc. If we're looking in my years of experience working with race equality and inclusion, every policy had to undergo an EIA, which is an equality impact assessment. And I know that in terms of safeguarding now, there is a much stronger emphasis on the voice of the child, the voice of the baby. And I just wondered if we could use that as a slant in terms of approaching how we view manifestos or how people look at them, to say, but there's nothing here that focuses on the voice of the future, if you like, babies and children.
Yeah,
it's just a suggestion.
No, I think that's really good, and I know that it would be a really interesting kind of see that work develop in Scotland. I think it would be a really good model, because I know that kind of Vicky and has done lots of work on voice of the child in that kind of work around the kind of, I think that was a big element of the work that she's done around the promise, right, Eliza? Am I right in saying that? Oh no,
sorry, not pressing the right button. Yeah, Vicky has, and I think there's like lots of, obviously because UNCRC was put into law last year, I think there is like a much greater focus and sort of the calls to ministers about like their legal responsibility now. So part of the manifesto calls certainly include like rights of the child, rights of babies, and I guess very specifically using the language around babies and not early years, because I think that can be very easily conflated with like early learning and childcare. So yeah, there's been really specific thought into some of the language that's being used. Save the Children and Joseph Rowntree have also done a bunch of research around child poverty and like language and messaging. And I think that report's going to be released in late October. There's some interesting stuff coming up that I think would be able to be used across nations, that we can kind of circulate probably, Matt.
Great, that'd be really helpful. I mean, yeah, just as you mentioned, Joseph, I can't remember if I mentioned the last one of these calls. I've been asked to join the Joseph Rowntree's Essentials Guarantee kind of campaign with the education subgroup, which is a little bit of a stretch for us for how they want to kind of talk about it, because they're obviously talking about education is from school, and I keep trying to kind of talk to them about, actually you need to think about it really widely and focus on babies and small children. Kind of that's when like the first kind of learning environment starts. everyone else is involved in school and school-age children and teaching unions and stuff, but we're involved in that campaign as well. Anyway, right. Thank you, Rose, for that bit. That's really helpful. NDR closed about a week or so ago. We've not published the figures yet, although I think that Lindsay has locked the form now, so we don't think these numbers will change. And if they do change, they'll change very, very slightly. But so I just wanted to share some of the numbers from it, especially around kind of things that jump out to me as that I think kind of relate to this kind of meeting. So number of families and children supported, I think that's 57,000, excuse me, that's 57,000 rather than 47,000, but it hasn't changed much over the last year. It might have gone up or down by 1%, basically kind of stayed static after a kind of quite a big jump last year. This is, whenever we look at this is UK-wide data. There is variation across nation, across size of Home Start. Like, this is UK-wide data at the minute in what we're going to look at today, but I flagged up where there are kind of significant variances. There's an increase in referrals as well, which is kind of, what I don't think would surprise anybody. The kind of demand for Home Start support kind of keeps going up. But something that really jumped out to us initially was the referrals that have a child protection plan or a children in need plan, which is now over 4,000, and that's up 11% last year. It's about 10% of referrals come with that, and then obviously a big increase in families referred on to child protection services, which really jumped out at us. But when you look into it, that rise is pretty much only in, or at least is most significant in England, and in actually Scotland that number went down, and Wales went down. It went up a bit in Northern Ireland. It went up proportionally, went up quite a lot in Northern Ireland, but in terms of numbers, not great. But in England it did, and I'm really interested in why that's happening, both from an England point of view of what is it about the system in England that means that Homes and the way that Home Start interacts with it, that means that Home Start is seeing an increase in more kind of complex families, or families where this is something with children. And why is it not happening in Scotland? Is it something, and I have no kind of preconceived ideas about why that would be, but I think that's really, those things are really interesting. I'd be really interested to hear kind of anyone's thoughts on that, if anyone would like to share.
I think the number of children on the child protection register in Scotland is generally going down. So okay. I don't think by 16%, but yeah, I think it has gone. I can probably get you those figures, Matt, though.
Yeah.
I think we also need to.
Sorry.
Sorry, Matt.
What was that, Matt?
Do you know why that is, or does anyone know why that is? Is that kind of, have they been doing?
Scottish government might say it's got to do with the promise. I don't think. Yeah, I'm not sure that there's like a single answer to that, okay. But yeah.
Okay, that's interesting. Just to say that because Scotland, Wales, and Northern Ireland numbers are the numbers initially are quite small, or smaller than England. Like the NDR data is really kind of heavily weighted towards England. It doesn't take huge numbers of movement within the Scotland nation data to make quite big percentage jumps. So anyway, Shelley, you were
I was just going to say, I think we need to be really careful not to make too many crude assumptions about this data, both in terms of increase in referrals and whether that does actually relate to general kind of increase in need and demand, and also the increase around case planning. So what we know, and I think it'd be really interesting to look at this in the context of income for the network as well, because we know that because we've increased capacity and delivery as a result of increased income over the last couple of years with the family hub stuff particularly, that we've also seen an increase in referrals because there's increased connectivity with other services, etc. So that's kind of the reason why our referral rates have gone up.
Yeah.
And then similarly, so with the children on child protection or child in need, we're specifically commissioned in Manchester to deliver an Edge of Care partnership offer. So inevitably our referrals with children subject to those plans has massively increased, because actually that's part of the criteria for that project. So I think we just need to be careful about assumptions we make just based on that. And I don't know how easy it would be to do some comparative stuff around income and increased capacity, and also the number of children that are being supported across the network. But I suspect that it's not as simple as there's more need, and needs are more complex and escalating across the population.
That's really helpful, Shelley. Yeah, I think that's right. And I think, I mean, the more you look at the NDR data, like the more you realize actually this is really quite complicated and really hard to kind of create a national picture, because even if you look at that rise in England, a portion of the network have seen rises, some have seen falls, right? And so kind of it's hard, depending on what work they do and everything like that. So what I haven't been able to do is kind of I haven't had a chance to map which areas have seen kind of rises, and then see have they seen it, do they correlate with an increase in capacity? Are those areas where there might be kind of family hubs also, or where they're kind of more connected in with local? I don't know, but yeah, so that's really interesting. Has anyone else got anything else to kind of share thoughts on that? Yes, so Ellie first, and then Prue.
Yeah, I would agree with Shelley in terms of, I think with our service, it has, we're much bigger now. We've taken on more staff. So obviously we're going to be taking on more referrals, when we're commissioned to do that or we get funding. I also think that we've moved more towards self-referrals. So I think that means that we potentially then are working with families that are more complex, because we don't always know that when we first start working with them, and then we gather that information. So that could be one of the reasons in terms of the complexity of the families.
So that's really interesting. But no, I haven't included this on this slide, and it's a big oversight, but the continued change in referral sources, kind of away from health visitors towards self-referral, is like something that is one of the most remarkable kind of stats that I've seen in the 10 years I've been here. Like when I started, it was about 2/3 health visitor referral. It's now self-referral is the biggest, and it's about kind of 30% health visitor is just a bit is below that. I mean, I keep saying this, and I do need to follow up with the Institute for Health Visitors, but I'd like to do some work with them to kind of work out why that is, and to talk to homes. That's why. Is it because health visitors see families less and have less time with them? And are those families, the same families, coming through as self-referrals that would have been referred anyway? Or are we missing families? Like I don't know. But also that's a really interesting point that I've not considered, Ellie, before, is like, if you've got a self-referral, what are the implications for us or for you not knowing all the information that you might get from a referral from a health visitor, right? So that's really interesting. I think definitely one that I'd like to look at this year. Okay, brilliant. Prue, then Eliza.
I just wondered, in terms of that focus and identification of more children with additional needs, more complex families, whether that in itself is an indication across local authorities as to around how hard it is to access other services. The threshold keeps rising, and therefore, in a sense, what might have been originally universal preventative work is actually, that point has been missed. And therefore, as Ellie was saying, that when the families end up self-referring, it's because they can't sometimes get help from anywhere else, and also are in a more challenging position than they might have been of a self-referral 5 years ago. The other thing was to actually look at seeing how, I would like to see whether, because of this drive or the pressure to take on families with more complex needs, where does that leave the family with a lower level of complexity in terms of Home Start's original brief around universal support and our role in preventative work? And we all know that if you can get in there early enough, actually the families can be most effectively supported.
I think one of the really interesting things, I will come to you, Elijah, in a second, is that so Home Start, I think, is supporting more families kind of now than it's ever done, even though there are far fewer Home Starts now than there were but the number of home visiting the amount of home visiting we're doing is still increasing, even though it decreases the proportion of work because the rise in kind of group work and other services. It's still that kind of home visiting, kind of traditional Home Start work is still a big focus. So Carol first, then Eliza.
It may be because as well we've got such a reduction in health visitors. We've got a real shortage in our area, and this is over the last 4 years. So when we do go into families, we're going into families later. So where health visitors might have referred previously to children's services, it's not happening until we've gone in.
I think that's so true, and it's in the comparison with Scotland is really interesting, because I think there is more health visiting that happens in Scotland, and health visiting has remained a kind of, its levels of referrals remained higher, although even that is now kind of falling, and it's actually, you know, it's falling back into line with what we're seeing across the UK. Eliza.
Yeah, I was just kind of curious, Matt, the health visitor referral numbers, like for Scotland specifically, did they see as significant a drop as they did across the board? Just like kind of acknowledging that the sort of health visiting service up here is slightly different than that down in England. So yeah, would just, I guess, like the broader question about nation specific stats and when they'll be available to us is
So I did do the ones for Scotland, and I prepped them for the meeting last week, Eliza, but we didn't get a chance to look at them. So I think that over the last few years, Scotland has still been higher, and health visiting has still been quite a high. It's not been near the 2/3, but I think it's fallen. It has fallen back, and it's fallen back again this year. So the trend is kind of down in health visitor referrals and a rise in self referrals across the board, but it's still, I think, a little bit higher in Scotland than it is in England. Yes, Lisa. Oh, hi, Lisa.
Hi. Obviously, at the moment, I can only see the stats for our Home Start across 2 local authority areas. But again, what I would say is I've been here for 11, 12 years, and I can certainly say that we've gone from being, say, back at some point 80, 90% health visiting to, and I wouldn't say it's necessarily that it's gone down. I think that what has happened is the other referrals have increased.
That's interesting.
So for us, you know, we have more child protection referrals, more social work referrals, more self referrals, greater than it's ever been. And then more sort of early intervention agencies referring in. So I don't know that it's necessarily the health visitors that have dropped for us. It's just that the pie looks different for who's referring, and there's an increase elsewhere.
That's really interesting, and definitely a bit of analysis that we'd need to do before kind of looking at this kind of further. So that's been a really helpful kind of conversation. I say we're just starting to kind of look at these numbers and dig in. There is a dashboard that will be released this month. Lindsay has been doing some great work with Power BI and allowing you all to kind of access this data and dig into it a little bit more, and then obviously look at it by nation, but also for those of you who are working in you know, either across city regions or kind of in consortiums, you can kind of build up you can build up kind of the picture of across more than one Home Start in it as well. It's hopefully a really useful tool. Right, the other bit, and I will skip past this kind of quite quickly, but there was obviously mental health remains kind of the highest source of, or highest how do we circumstance then that is on a referral form, and it's over half, but that's been a huge increase since 2012, which is, I think, is quite interesting. All kind of circumstances have kind of increased in prevalence of recording, and I don't know about something about how we record that and how we report on it, or whether that's people are more likely to kind of talk about what they're being referred for. Debt and finance continues to grow, increases in Scotland as well. Unsuitable housing remain kind of static, but it's still kind of more than 1 in 10 families that are in unsuitable housing that we support, which I think that while you think, okay, 12 as a universal service, as Prue says, for have 1 in 10 of the families that we support in unsuitable housing, I think is I think something of note, and something that we really indicates the situation for families at the minute. The biggest increase was in families with disabilities and also within speech and language issues. Again, it'd be worth kind of looking at some point, if we have chance, looking at why that might be at some point this year. Yes, Prue.
On that final point there, speech and language issues, I'm working in Oxford with the Early Language Pathways team and looking at speech and language and communication difficulties. And the first session we had, the speech and language lead said, numbers have gone up significantly in children with speech and language difficulties, but I asked her to what percentage of those children were in fact children who were new to learning English as an additional language. She didn't have that data. And if you haven't got that breakdown of data, any generalized information about speech and language will be inaccurate. So to say that a child has speech and language difficulties because they can't speak English yet is totally inaccurate and is actually quite discriminatory. So I would want us to be able to say, and it's something that we're working towards in Oxford with our data, but we haven't got it yet, as to what percentage of our families actually, and how many languages are spoken. And I think that's, if you're looking at our EEDI as well, actually that should be in there. And I also have issues sometimes when they're seen as, oh, well, their language isn't good enough yet. Well, actually, are we talking about our monolingual children or our bilingual children? And also, I would rather that families were referred to as bi and multilingual rather than children who are learning English as an additional language in that much broader global concept. You can see it's a personal beef. I'm sorry.
Okay, so just some thoughts that I'd kind of pulled out that I thought that were the kind of biggest stats that jumped out across the kind of whole UK-wide population together, but there will be things that we can dig into in either regionally or kind of nation-specific stuff, and we can kind of pick that up separately. I did have a question about volunteer numbers, but I'm going to jump on from that, and I might email people later because just want to make sure we get an accurate picture of volunteer numbers this year. And I think how we've asked the question might have confused things. So, but I will come back to that because I don't want to take up time with that now. And I'm delighted that the people who are renovating the house next door to us have just started. So I've got drilling going on next door, which has been brilliant for like the last kind of 6 weeks. And I've now found out we're going for months. Brilliant. So I want to move on now. We've got about kind of 20 minutes to go onto Family Hub. But I do know that Family Hub is obviously England only policy. So if you were from Scotland or Wales, Northern Ireland, and didn't fancy sitting through listening to England Family Hub policy, I would not be offended if you decide to leave and have different use of your time. But I would say that if you is something that you want me to add onto the agenda next time that is kind of specific to Scotland or Wales, please do. I'm always looking for things for agenda items for these. The next one of these will probably be December or January time, probably January I would think, but so do let me know. But on Family Hub, I thought it'd be just useful to kind of update where we were, what we'd been doing, and then kind of just open it for any kind of discussion to see how you'd found it, and any kind of feedback locally. So Better Start in Life policy was published in July, just after the 10-year plan for the NHS, and it committed to rolling out the Family Hub programme, rebranding it the Better Start Family Hub program, and I think 500 million, and increasing it to 1,000 family hubs across England, one in each local authority, at least one in each local authority area, but then also obviously focused more heavily on areas of higher deprivation. So far, there have been the Family Hub was initially launched about 3 or 4 years ago in 75 local authority areas. There are currently 40 home starts that work in those 75 areas. So there are some home starts that work across kind of multiple local authority areas. I'm thinking of Host is one, but there are others where there are 2 home starts that work in a single local authority area. I think that happens in Leicestershire, for example. So, however, I did a survey earlier in the year to ask, how are home starts getting involved. I had about 20 odd responses, and about just over half said that they were delivering services with or through Family Hub, and about half of those just about said that they were getting funding through. So there are lots of ways, and the thing that came out was it's been really hard to get a picture of how Family Hubs are operating up to now. Because they operate differently in every area of the country, and home starts have been engaging with them in a complete variety of ways. There are some home starts that are delivering quite a lot of services through their Family Hubs, and they've been able to get significant kind of funding to run a range of services, both kind of home visiting, but also home learning environment programs, perinatal infant support programs, Dad Matters, for example, or down to quite small amounts of money to deliver a small focus pot for home visiting and outreach, and then also delivering services through Family Hubs but not getting any funding for it, or either accessing the building or actually receiving referrals through the Family Hub system, but actually not getting any funding attached to that. So the whole range of ways that we're engaging with it, and on other areas where it's just been impossible to engage, even though that the home starts have tried. So it's a big mix so far. And the focus that was announced in the Better Start in Life strategy, if I'm sure you've all seen this, but is to focus on the Department of Education element of this funding is to deliver home learning environment programs and parenting support interventions. Now, and both of those have to be what they call evidence-based programs. I didn't develop this strategy, so don't shout at me, anyone. But for the next 2 years, that's meant to be targeted at children who are 3 and 4, because they are the people who will be meeting the good level of development when they're in their foundation year at school, and that's their target. Or it was up until about a week ago, and then they decided they seem to have lost interest in their opportunity mission a little bit, but still, that's what everyone's working to, and it's kind of baked into the program now that it'll just have to happen. Interestingly, the Department for Health element of funding that was delivered through Family Hubs, the Start for Life funding, that level hasn't been announced yet, and no one knows when it's going to be announced. So that's still tied up in as I mentioned a few minutes ago, the 10-year plan for the NHS. NHS funding is still being worked through, so no one knows quite how much is going to be there to deliver actually a lot of the work that Home Starts were doing. So if you were getting funding, I think most of that was coming through kind of health rather than education. We don't know what that element makes up, and it makes up a big kind of portion of the Family Hub system. And it's also, I've just included this because I did this for our trustees the other day, and we said let's put some context in about how this ties into levels of Sure Start funding. It is nowhere near what was invested in Sure Start by the end. But I do think there are lots of ways that Home Starts, or opportunities for ways that Home Starts can get involved in the Family Hub system. But I don't think that it will be as transformative. I mean, it's obviously not going to be as transformative to Home Start as Sure Start was. What we're doing so far, and what I've been trying to do, is trying to share as much kind of information and learning as I can. We've obviously been engaging with the Department for Education and Department for Health and Social Care as they develop their plans. I've also been engaging with the new National Centre for Family Hubs, which has been set up by the national, what's it called? The LGA.
Local government.
They've taken that on. They picked it up from Anna Freud, and they're only contracted to deliver that until March next year. And they have 9 regional coordinators who I've reached out to all of them, and I'm trying to meet all of them just to introduce Home Start work. And I'm trying to then kind of hopefully see what opportunities there are around the country for Home Starts for them to connect to and either join communities of practice, or if there is kind of anyone's interested in giving local webinars or meetings and things like that. So I'm trying to kind of make those connections. So I met with the the lead for London yesterday. I've met with the lead for the North East and for the West Midlands. I've got other meetings kind of coming up. They're all really enthusiastic. They are only doing a day a week, which seems to, but their kind of role is to really share best practice amongst local authorities, to kind of gather what's been working so far and make sure local authorities have access to that, because they're going to have to operate quite quickly and make decisions quite quickly about what they want to deliver and what family hubs are going to look like in their area. And I just, I want to make sure that Home Start is in their thinking, and they've kind of heard, those who haven't kind of considered it in this space, that they're kind of making sure that they know that Home Start should be playing a role in what they're kind of setting up. And then,
could I just ask, Matt, how are they going
to
disseminate their information? Because the Local Government Association, because the Anna Freud Foundation has been outstanding in its way of disseminating best practice, providing workshops, learning experiences. So if they're only doing 1 day a week and there are 9 of them, it's going to be a hard act to follow.
Yeah, I mean, some of the people have been transferred over from that were involved in the from the Anna Freud Centre. Like I think, and I think that from when I've met these people, I think they have been really great, really enthusiastic. They're meant to be running, I think, 3 community of practice sessions between now and March. They have got a series of webinars and events for local authorities that exist now kind of throughout the year. We're running a session on Dad Matters in October, and also in October on Home Start in general. I've got they've asked me to put that on, and I've got Sarah Cook from Host and Joe from Home Start in Cornwall, Home Start Kernow, presenting how they're working with family hubs to give a kind of nice rural urban north-south kind of split. And that's going to be for local authorities to come and hear ways that's working. And they've got local authority kind of members kind of presenting there, because I think obviously the audience is local authorities. They want to hear from their peers. They're also kind of sharing case studies as well, and we're doing some work with like a public affairs company called Ecoris, who are doing some pro bono work for us to kind of capture about 4 different ways, speaking to 4 Home Starts, to create some case studies that we can share either with local authorities, that we can pass that to you. And I also know I've heard that actually a lot of either you or your trustees would find it helpful to have examples of how Home Starts have been engaging to kind of shape your thinking and their thinking. So we'll have that hopefully in the next kind of 6 weeks. They're just doing some interviews now with people, and then obviously we can share those case studies. Yes, Pam.
Yeah, hi. I've been with Home Start North West Leicestershire for over 33 years. And I've, in all that time, I've done the Sure Start, and now we're on family hubs. And we used to do a lot of work through the Sure Start centres. We used to do MIMS. We used to do Baby Giggles, which was early communication. We used to do their volunteer recruitment for them. A lot of things, running their stay and plays. And when family hubs were open, there was a new manager appointed, and literally she has cut us all out. She is empire building, and I don't mean to sound negative, but I feel quite negative. And she is empire building. She's moved away right up the scale, the one for our area. And Leicestershire is split into 2. And, we've got the Ready for Schools project currently running. All they'll do is just spend a load of money replacing it. They've just got a load of money to do some speech and language, and taking up on Prue's point, they've said that they've got that because over half of UK adults have a reading age of between 9 and 11. But again, there isn't any, they're not looking at where those people have come from or their ethnic origin. They, that's just I just feel they've now put it out on their Family Hubs Leicestershire website that they're recruiting volunteers to be parent mentors. And it's like, hello. So yeah, it's just a moan, really.
Yeah. I mean, I completely understand why you're moaning, and it's a real challenge. I mean, I think that from our point of view, what we what we can do is have as many of those conversations with people who can kind of know about Home Start and advocate for it. And all the people that I've met so far through this National Centre have known Home Start and have worked with us before in kind of commissions. Go, yeah, we completely get it. It's brilliant. And can you talk now how that translate when you've got kind of local commissioners will vary from everyone, right? And I can't, I don't think there. I mean, it's when they wrote the guidance for Sure Start, essentially it was basically written in that you had to have Home Start, right? And that's why there was such a big growth of Home Starts in the late 90s, early 2000s, right? Because it was baked into the system. That's not going to happen now. And I think that the decisions are kind of devolved kind of more locally. At that level, I don't think there's a huge amount that Home Start UK can do, other than the work that we're trying to do at kind of those kind of regional levels and national levels to try and promote and talk about Home Start. We're trying to meet with the organisations around kind of Nesta and foundations that are really kind of focused on this evidence-based kind of approach to say, actually, it's not always and often not appropriate. Like that can't be the only kind of solution that you're looking at. And actually, when you're working, but we keep making that case. But yeah, it will be a challenge, and there will be some Home Starts that I think that kind of will end up doing a lot of work with their family hubs, because I think there will be some that do kind of less. But I also think that what family hubs will be an element of Home Start. When Sure Start happened, I think that especially in those early days, for a lot of Home Starts, it was basically the majority of work was based on that. I think family will only ever be an element of Home Start's work now. Actually, I think that's probably quite a good thing, because the wider the variety of work that we do and funding we do, the more sustainable Home Starts are. But I think it's slightly kind of it is going to be different. It'll be different across the country. So creating a national picture is hard. Yes, Prue. You're on mute, Prue. Sorry.
Just one quick query following on from that. In Oxfordshire, we've had some discussions about this new rollout of family hubs and disingenuously saying that Oxford didn't get money, whilst failing to say that actually Oxford didn't bid for money and that's why they didn't get it. But equally, from that point of view, when you were talking about them having the local government association people having a meeting or a session for all local authorities, is there any way you'd be able to find out whether Oxfordshire attended, and if so, who, in terms of giving us a steer of who might be to go to? Because it's just, it seems to be lots of words, but actually no real action at the moment. So it'd be interesting if there's any way of linking through that.
Yeah, okay. And when I get that information, like I try and do send that out. And if there are any kind of connections that either you want, Prue or Catherine as well, into those people, I can make those connections.
Thank you.
Right. And so just finally, just the timelines on this, as we understand it, at some point in the autumn, probably October, the Department for Education will be doing some guidance, but they are apparently kind of meant to be co-producing this work, and so because there are obviously lots of local authority areas that have been delivering family hubs already, and yet the guidance will be slightly different, so that they don't want to kind of upset them. There are quite a few local authorities that have been running family hubs already, but without the DFE funding and any kind of intervention from the DFE, who will now be getting in, requirements of what they need to deliver, and they want to try and avoid upsetting all of them, so they're going to co-produce that. By the end of the year, local authorities will have their targets for their good level of development. That will all be set kind of locally. They'll be agreed with the Department for Education, but there's obviously, you'll have heard, there's a 75% target that we have to reach across England. or the government set themselves that target, but that there will be local variance in that. So if your local authority is miles away from getting to 75%, they'll have a lower target than one that is closer. Similarly, if you've already at kind of 80%, I think they'll likely be set a higher target just to make sure they don't just decide they don't need to do anything. And so that will kind of vary where you are. And then by January, there'll be at least one site that'll be delivering those interventions, and those limited interventions that we talked about will be meant to be being delivered from April 26. So they'll be making kind of decisions quite quickly. Is there anyone else? So that's where we are and what we've been doing. It'd be really interesting if anyone else had any kind of experiences that you've already had working with family hubs, or if you're not working with family hubs and they're being set up, whether you've had any kind of engagement at all with local authorities, discussions about it, and just seeing how that's kind of working locally, if anyone wants to share. Michaela, yeah.
Hiya. I'm not sure, is this working?
Yeah.
Oh, perfect. Sorry, my microphone sometimes doesn't work. So we've got here down in Hertfordshire, we've got a perfect storm of de-evolution of our county. So splitting up new different ways and trying to find out which way it will be split. We also, obviously the same as everybody else in England, are going through this with hubs. And what is staggering for me is the fact that they've just issued as of 1st of January, we are lucky enough to have family centres here. 5-year contract to one YMCA when they knew the family hubs were coming. So it's now families are struggling even for spaces to be recognized or identified to be able to provide this service, let alone having more than one in the county. So I think we are here in a kind of pot of madness right now, because there is so many things happening within the county and it's not synchronized. It's not let's do A, then we can do B, then we can do C. It's just being kind of muddled up. So we are trying to attend every single meeting we can. We are trying to learn from everybody and anybody. We have actually been approached for through the social care service, by their family engagement worker who is in place literally just for this period of the transitioning. And she approached us if she could work with our families to get their voice of the families, voice of the service users. What do they want to see in hubs? What do they, so our families had a really strong input in shaping this. We'll see how that transpires a little bit later on when we are actually seeing those hubs open. But our families, we have brainstormed the new names for the caseworkers, for the family workers. They were just amazing. So I'm really proud of that our family's voice has been heard in all this madness, really. So let's hope it will make sense sometime soon.
Yeah. Anyone else want to share? I mean, Shelley, I know that family hubs have been, I mean, whenever you have one of these conversations, eventually it comes back to family hubs are being running, like Greater Manchester is seen as one like almost a flagship area for family hubs, I think, is what people want to point to of how family hubs should be. And I always say that I'm sure it feels like from the outside, because I end up coming back to how the family hubs operate. It might feel slightly different from the inside out, but
yeah,
everyone points to Greater Manchester, right?
Yeah, absolutely. And I suppose, yeah, you're right. I mean, it's provided us with significant investment. And we've been commissioned quite heavily to provide the peer support element of the parent-infant relationship stuff, which is great. But I think, picking up on the other conversations, because similar to other areas, the Family Hubs model is kind of piggybacked onto the Sure Start Children's Centre model, which actually we've really battled to penetrate. Even though we're based in a children's centre and have been for 15 years, there's a clash in culture, and it's just been a really challenging kind of partnership. So it still feels like we're the bit that's been commissioned over here because that's what the DFE said you need to deliver, Manchester. And actually we're still battling that culture of a focus on successes based on footfall into centres, and it's still very centre based rather than thinking about that kind of outreach community model. And actually it's not outcomes focused at all. And that's why they love Dad Matters, because the volume of output is so high, but they're still interested in how many families are we getting into children's centres, when actually the spec and the tender had no focus on that. So it's a challenge to kind of shift mindset around. There are many families for whom walking into a centre is not the answer, and that's okay. So it is a massive challenge still, but we still feel really lucky to have got that investment.
Yes, interesting. Prue. Yes.
I just am concerned about, having had the webinar around the Henry Smith new fund, which is very closely linked to the government's Northern Powerhouse initiative in terms of funding those authorities where there's the greatest amount of deprivation, is actually not in terms of whether or not one can access it, but just seeing what impact that will then have on how government funding rolls out in terms of new family hubs or whatever, because of that financial directive that they've got. It would just be, just raising it as a question, really.
Yeah. Okay. Anyone else before we wrap up? Because I realise we're at 11 o'clock. And then there are some messages in the chat as well. But so thanks for your kind of thoughts, Sarah. That's really helpful. And Pam. Right. It is 11 o'clock. These sessions are only an hour. Thanks very much for attending, everybody. I hope it's been useful. Yvonne has asked me to set out the dates for if I want to do these again for next year, because I think this was the last one that was in the diary. I'm really happy to kind of carry on doing these if they are of use to people. I don't want them to go in the diary if they're not useful, but if they are, great, and I'll keep adding them in. And they're useful for me, but I want to make sure they're useful for everybody else. I'm seeing some nods, so that's good. So I'll go back to Yvonne with some dates then. That's great. Okay. Thanks very much for your input. The video will be shared. I'll share the notes, and I think we'll look at what we're going to kind of focus on from the NDR as kind of key kind of themes, and I'll come back out, I think, with some questions to plug into that data a little bit more as we go. Brilliant. Thank you very much, everyone. Have a good day.